Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop foot pain. But before I do that, I'm gonna go over the causes, risk factors, basic anatomy, and then we'll get to the root cause of foot pain and how to stop it at home. There are several causes and risk factors for foot pain. One of the most common causes are bad shoes. So if you wear high heel or non-supportive shoes or flip-flop, that could be increasing the risk of having foot pain. The other cause could be from a sprain, and that's usually happen if you twisted your ankle or you fell and with twisting your ankle or had accidents or a sports injury. Abnormal gait is another cause or risk factor for having foot pain. So if you not walking the right way, heel to toe walking, or your gait pattern is not normal pattern, that will cause a lot of stress in your either Achilles tendon or plantar fascia or other tissue in foot that will increase your risk of having foot pain. Also, if you have plantar fasciitis, and you can see it in here in this image, your fascia is inflamed here, and that's usually happen from micro tear or strain in this area. And you might also have a bone spur, and that could happen here, and that's usually happen with pronated foot, like foot is collapsing, or having wearing non-supportive shoes, or your gait is actually not the proper correct gait pattern. And you can see it here in this image. When you start to have like heel bone spur, you start to irritate the plantar fascia, and that causes plantar fasciitis. And I have a full video on how to get to the root cause of plantar fasciitis with more depth on the treatment for plantar fasciitis in my YouTube channel. Feel free to check it out. The other risk factor or cause could be Achilles tendonitis, and you have the Achilles tendon here, and that's attached to the calcaneus bone. And this is a common issue with athletes or a lot of people that has tight calf. That's could be as a result of high heel, walking with high heel. So you can see it here in this model that the calcaneus bone in here, and you have in the back of your foot the Achilles tendon. And when you have a lot of tightness in your calf muscle, that's gonna pull on the tendon of the Achilles tendon and will irritate, cause bone spur in this area, and cause Achilles tendonitis. And I also have a full video on Achilles tendonitis in my YouTube channel. So excessive pronation, and you can see it here in this image. The middle image here is a neutral alignment of your foot and your leg. And when you have pronated foot, your feet is actually collapsing inward. So the arch, instead of you having arch like this, that arch is decreasing and actually collapsing. And you can see it here in the first image. When that happens, your calcaneus is actually going outward. And supinated foot is the opposite. You have excessive arch, and pronated foot is actually one of the common risk factors for a lot of issues in the foot. I personally had pronated foot, and I was able to correct it with certain exercises and releasing the fascial restrictions and scar tissue. And that's what caused to have plantar fasciitis for myself. And after correcting that, releasing the fascial restriction, the scar tissue, I was able to get rid of the plantar fasciitis. But pronated foot is actually very common risk factors. Also, as I mentioned, heel spur, and that's usually happening wherever you have more stress. And also you could have bone spur like in different areas in your foot if your shoes is very tight and actually cause a lot of restrictions in your foot. The other thing that's not here, Morton's neurome neuroma, and that's usually happening between the second and third metatarsals here in this area, that inflamed nerve in between and irritated, that actually the symptoms is related to inflammation and scar tissue that compressing on the nerve that cause the Morton's neuroma symptoms. And I have a video on Morton's neuroma in my YouTube channel. Bursitis, inflammation of the bursa, or if someone has rheumatoid arthritis, that's a risk factor for inflammation in the joint and cause foot pain. Gout, peripheral neuropathy, that's also related to diabetic patient. When they have high blood sugar for a very long time, that will increase the risk of having nerve irritation and numbness and tingling in the foot and causing the peripheral neuropathy symptoms. So the other causes and risk factors could be sports injury, like if you are a runner, jumping, or tennis, or playing other sports that the sport itself will not cause the injury. When you add bad anatomy, bad shoes to sports training, that will increase your risk of having foot pain. Also high risk is men running in worn out shoes. If your calf is very tight, that will increase the stress on the Achilles tendon, causes Achilles tendonitis or plantar fasciitis. If you have a bone spur, are also the other risk factors. If you have high blood pressure, cirrhosis, or you're taking medication like antibiotic. So one of the most important questions is how to treat or how to stop foot pain. And in order to answer this question, we need to understand the normal healing cycle. I'm gonna use external paper cut for visualization, but the same process happens internally from accident trauma, from like any foot injury like Achilles tendonitis, bursitis, bone spur, plantar fasciitis. Your body has to go through those 3 stages in order to heal. So the first stage of healing, when we look at the paper cut, is inflammation. You can see it here in this image. Swelling, redness, the blood starts to rush to that area. The second stage of healing is called the proliferation stage. That's when your body starts to build the scar tissue. During this stage, there is actually a cascade of events: fascial restrictions, muscle spasm, trigger points. For the sake of our time, I will focus on the scar tissue here. So why scar tissue could be an issue? Because our muscle should act like a rubber band when it contracts and relaxes, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, will not stretch much. Perfect scenario, actually during the maturation stage, your body should get rid of everything here in the proliferation stage and the inflammation stage. That could take days, weeks, months, or years. If you are in chronic condition and you still have pain, you're probably going back and forth between inflammation and proliferation stage. So when we look back at knee injury, from bad shoes, that will cause a lot of inflammation, a lot of tightness in your muscle or your calf, and will cause scarring in the area that is actually compensating for the bad shoes or bad anatomy or bad gait pattern. If you have Achilles tendonitis, is inflammation of the Achilles tendon. So, and if you have bone spur, that's a scarring in the bone that's actually caused the bone to calcify. And plantar fasciitis is the same thing. So the root cause, or to treat the root cause of the problem, we need to really understand or distinguish: are you stuck in the inflammation stage or the proliferation stage, or are you actually going back and forth between inflammation and proliferation? So in this image, you can see in the first image, healthy tissue or healthy muscles. You should look like nice and smooth tissue like this. So when you have a strain, sprain, or any tissue damage, you start to have a micro tear in the muscle or the tendon, the ligament, and your body has to build the scar tissue to glue everything together. That's part of our survival. So if you have external paper cut here and your body does not build the scar tissue, it's open wound susceptible for infection. So actually we need the scar tissue. But the problem is when we have excessive scar tissue, as this image, the scar tissue starts to build randomly. And actually, you can palpate in your foot, your Achilles, your plantar fascia. And if you start to feel like there is a nod or kind of uneven, thick tissue, that's properly a scar tissue sign. So, how to get to the root cause of the problem? We need to go over the proper treatment for inflammation and proliferation stage. But before I do that, I'm gonna go over some of ineffective treatments so you don't have to waste your time on it. So one of the common things that been used with a lot of healthcare providers and athletes, ice and heat. And when we look at the normal healing cycle here, ice temporarily gonna decrease inflammation, but there is nothing gonna, the ice or heat or electrical stimulation will not do much to breaking down the scar tissue, releasing the fascial restriction, or decreasing much of the inflammation. So study shows that they provide temporary pain relief, ice, steam, and heat, but there is no long-term result. And when we relate it to the healing cycle, it's not really getting to the root cause of the problem. The other thing that's commonly used is foam roller. And when we look at the healing cycle, if you have inflamed tissue, do you want to rub it? That could cause actually more inflammation. And based on the study, does not provide long-term pain reduction, and it's not going to do much to the scar tissue, the fascial restriction, the muscle spasm that's deep internally. The same thing for massage. There are several systematic reviews shows that massage provide either temporary pain relief or no pain relief. And actually, it's hard that when we go over the anatomy of the fascia system, it will make a lot of sense why massage is not effective treatment for foot pain, because with the hand or the knuckle or the elbow, it's hard to really go deep to the tissue that has a restriction or the tightness, and I will explain that in the next few slides. So the other thing that commonly used is stretching. I personally do not recommend stretching for my patient. There is other safe treatment than stretching for foot pain. So I personally do not recommend it to my patient. Why? Because if you have a micro tear in the muscles, you have tightness, you have a scar tissue, and that micro tear, if you continue stretching your muscle, that micro tear will be major tear, and based on the studies, stretching actually causes inflammation. So actually, it could cause more symptoms, more issue. I personally do not recommend it to anyone. The other thing that commonly used by healthcare providers, PT, chiropractor, occupational therapist, joint mobilizations, but based on several systematic reviews, it does not even provide a short-term pain reduction. And when you think about joint mobilization, it's just moving the joint. But when your problem with inflammation, that's not gonna do much to the decreasing the inflammation. If you have a scar tissue fascial restriction, working in the joint is not going to release the Achilles tendonitis inflammation or scar tissue or calf tightness. It's actually not relevant to the issue. The other thing that's commonly used is strength exercises. During the inflammation stage, it's actually not safe, because think about this way: you're very inflamed, you have a lot of tightness, and you start to do stretching, strengthening exercises, which actually could cause more inflammation. So we want to do strength exercises, but much more effective than strength exercises, something called functional training, that is more effective than strengthening exercises. But when you think about it this way, when you strengthen a muscle, is that going to decrease inflammation? No. Is that going to break the scar tissue, release the fascial restriction? Actually, the answer is no. So how to get to the root cause of the problem? So we need to really address each of these stages individually or simultaneously. So what I personally do for inflammation. So if you have inflammation, if you have a mild inflammation, just rest. Avoid tight shoes. Try to walk the proper way, and I will have a video on how to walk the right way. If you rest for like 7 days and your pain still there, that's actually a sign you have inflammation with the proliferation, your body going back and forth, or your foot pain is caused by inflammation and proliferation. So in order to really address that, we need to decrease the inflammation. So what I personally do is I use the MagnaHeal to decrease the inflammation. So the MagnaHeal device is very strong magnetic device that actually the range of the magnetic field is 3 inches. So actually we can use it for any of those conditions that's in here, the plantar fasciitis, Achilles tendonitis, ankle sprain, and wear it, and that's usually if it's a mild to moderate inflammation, that will get the inflammation under control. At the same time, I like to put my patient on anti-inflammatory diet, because there's certain foods like refined carb, refined sugar cause internal inflammation in the body for 5 hours after eating the meal. So that will decrease or slow down the normal healing cycle that going from inflammation to proliferation to maturation. Lastly, if you have a moderate to severe inflammation, we have to be extremely aggressive on decreasing those inflammation, and that could be a sign of vitamins, mineral deficiency. For moderate inflammation with the MagnaHeal 2, I like to have my patient use a pain relief cream that's actually anti-inflammatory cream that's actually used to decrease inflammation, speed up the healing cycle, and it has vitamins and minerals, a lot of natural ingredients that help with the pain and decrease the inflammation. For really severe cases that's the pain level around like 7 to 10 out of 10, that's indicative of severe inflammation, and that's a sign of vitamins mineral deficiency internally in the body. And while we work externally to decrease localized inflammation, I like to internally make sure we meet those deficiency. And what I do to address that, I put my patient on the severe inflammation supplement kit. It has collagen, magnesium, other vitamins and minerals that are commonly deficient with a lot of those patients that has severe inflammation, to decrease the inflammation and speed up the healing cycle, so the body will transition from inflammation to proliferation stage, then to the maturation very quickly. So at the same time, while we're decreasing the inflammation, we have to get rid of the scar tissue, the fascial restrictions, the tightness that caused during the proliferation stage. So what I personally do, I use the A3 to break down superficial scar tissue. I use it on the plantar fascia, the Achilles tendonitis, any foot pain. When you feel there's not the scar tissue, I use the A3 to do that. And I use the A5 to work on breaking down deep scar tissue, deep fascial restrictions. And that's why I said foam roller and massage not effective, because mechanically impossible with the knuckle, with your hand, to go deep, especially in the area like the calf muscles that's very thick, to break down scar tissue. So I can do that with A5 that's actually can go deep in the calf muscles, 2 inches, 2.5 inches deep in the tissue to cause that release. The other thing we have to work on simultaneously, and briefly I'm gonna go over that fascia system here, because it's a very significant cause or risk factor for having chronic foot pain, and it's overlooked by a lot of healthcare providers. So the fascia system, when you look at the image here, the white web tissue here, that's the fascia layers. So and you can see it here, and when you go by meet next time, you see those white filament, that's actually the fascial layer. So the superficial fascial layer, it's wrapping the entire body. It's like a very thin layer, like a Spider-Man suit, wrapping everything. But we have layer wrapping a group of muscle, each individual muscle and each individual fiber. To make things more complicated, but don't worry, the treatment very simple. We have 2 major categories of fascia: superficial layer, they're wrapping the entire body, and then we have the deep layer. The deep layer divided to 4 subcategories. The first one is the apparatic fascia that trap a group of muscles. Then we have the epimysin here that trapping each individual muscle, and the premiysin wrapping a bundle of fibers, and then the endomysin wrapping each individual fiber muscle here. So you can see here the epimysin wrapping each individual muscle, and then the premiysin wrapping a bundle of muscle fibers, and each individual muscle fiber here wrapped by endomysin. That's why I said massage foam roller are not effective, because mechanically impossible with the hand, with the knuckle, with the elbow, to go deep enough to address the premiysin, the endomysin, and the epimysin at the same time. So what we need to do is to actually go deep enough to release those layers. So what I personally do is I use the A1. I use the A1 to release the superficial and apparatic fascial layer. And then I use the A5. The A5, I use it to release the trigger points, deep scar tissue, and epimysin, premiysin, and endomysin. So to sum it up, how to get rid of foot pain and get to the root cause of the foot pain? Well, first of all, we need to really walk the right way, normal gait. Second, we have to choose a proper shoes. You don't want to wear high heel, flip-flop, or tight shoes. The other thing, if you have pronated foot or supinated foot, we need to correct that. Sometimes it can be corrected with exercises, and some patient has really bad structure that actually require a special orthotic, and I will go over that in other videos. At the same time, while we working on correcting the biomechanic, the anatomy, we have to break that vicious cycle of inflammation and proliferation stage. And in order to do that, we'll work on inflammation, decreasing the swelling, and then breaking the scar tissue, fascial restriction, muscle spasm. And that's somehow to treat the root cause of foot pain. If you have any question or comment, leave it in the comment section below, and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to ASTRinstitute.com.